In 2019, the California Senate passed SB 159. Senate Bill 159 allows pharmacists to prescribe HIV prevention medications. This includes pre-exposure prophylaxis, also known as PrEP, and post-exposure prophylaxis, also known as PEP. In 2022, we surveyed California pharmacists to understand their perspectives on HIV prevention services in pharmacies. These are our findings. We received over 900 valid survey responses across California, with 29% from LA County and 23% from San Francisco County. Among the different types of pharmacies represented, 41% of our survey respondents worked in community pharmacies. We discovered that 92% of pharmacists had heard of PrEP and PEP, but only 72% had heard of SB 159. 96% felt that provision of PrEP and PEP was important, but only 41% felt confident in their ability to prescribe PrEP. Only 27% of pharmacists had received training on PrEP and PEP, and only 11% worked at pharmacies that are implementing this bill. 53% of pharmacists said allocating staff time for PrEP services was difficult since only medications are covered by insurance. For pharmacies not implementing SB 159, the top 3 barriers to implementation were lack of staff and time to add new services, no insurance coverage for prescribing the medication, low perceived demand. Additionally, 42% said that the 60-day limit is insufficient for pharmacists to make referrals for follow-up care for PrEP. The good news is that pharmacists do not appear to have conservative views about PrEP and PEP that prevent implementation. The not-so-great news is that while there's a high level of willingness to prescribe the medications, there's not necessarily a high level of confidence to do so. And finally, here are a few policy recommendations based on our findings. Evaluate and reconsider the 60-day limit. Ensure payment for pharmacist-related services. Advertise training programs for pharmacists seeking to implement SB 159, and develop resources pharmacists can utilize to refer patients to follow-up care as needed.